Britain's elementary schools had only reopened for the new term Monday morning. By the evening, Prime Minister Boris Johnson had reversed course, announcing a third national lockdown.
The government is once again instructing you to stay at home.
So schools and universities are closed.
It is something which will have a deep impact on children, a deep impact on their well-being and mental health.
The lockdown comes amid warnings that hospitals are being overwhelmed. The number of people hospitalised with COVID-19 is 40% higher than at the spring peak. Total deaths have risen above 75,000. The new variant of the coronavirus, identified in southern Britain in September, is up to 70% more infectious and is spreading across the country.
We have people in their 40s, their 30s, their 20s on our intensive care unit dying of COVID. We are having to think about whether we do cancer surgery. We're having to postpone cancer surgery because of the number of COVID patients we have in.
It's been one of the worst shifts of my entire life. Intense. I'm looking after many more sick patients than I normally look after. It's just overwhelming, the whole situation.
Once again, the government must respond to an escalating health emergency and a resurgent economic crisis as non-essential shops and services are forced to close. The government announced one-off grants of up to $12,200 for businesses, but hundreds of them have already closed for good.
The lockdowns, the tier systems, etc., especially to the hospitality sector, have had a tremendous effect, an astronomical effect on the industry. It is really in a bad place.
But this time there is one big difference. Britain began mass vaccinations using the Oxford University AstraZeneca jab Monday. Already 1 million people have received the Pfizer-BioNTech vaccine. The government aims to inoculate 2 million people every week from Monday.
If deaths start to fall as the vaccine takes effect, and critically, if everyone plays their part by following the rules, then I hope we can steadily move out of lockdown.
That could happen by March if the vaccinations go to plan. But the government warns the coming weeks will be the hardest yet since the pandemic began. Henry Ridgewell for VOA News, London.